To diagnose frozen shoulder is actually quite straightforward. We see a lot of frozen shoulder in the clinic, but what's really important is to get the right diagnosis as soon as possible, because that means that you're going to get the right treatment program. Now, to diagnose frozen shoulder, there's a few things that we look at. First of all, the location of pain. Most of the pain on a frozen shoulder is not actually felt right in the shoulder. It's often felt down the front, down the side, and down the back, so it is quite non-specific, and sometimes that pain, particularly at night, can cause a very deep throbbing pain all the way down the arm. Now, to diagnose a frozen shoulder, as I say, it's quite straightforward, and your physiotherapist will be able to do that in the first session. At complete, we also will carry out a diagnostic ultrasound scan just to rule out any other conditions such as a rotator cuff tear, which can present quite similarly. Now, in terms of the movements that are restricted on a frozen shoulder, there's three key movements, and this is what we call the capsular pattern, or you present with a capsular restriction. The first movement that is restricted is lateral rotation. So that's when you keep your elbow into the side, and you can test this yourself, and then you bring the arm out, and often that is quite restricted. You should be able to get your arm to around 70 or 80 degrees, but most people with frozen shoulder are limited, quite limited in their movement. The other thing is to look at abduction. Now, abduction is when you bring your arm out to the side. So many patients with frozen shoulder can't get further than this, and what they then do is they then lift their shoulder to try and compensate, and often that can give you pain going up the neck if you've had it for a certain period of time. And the last movement is hand behind the back. So, you know, either putting something into your pocket, reaching behind you in a car, or for ladies doing up their bra. Now, the key thing to remember with frozen shoulder, and it sort of says in the title, is that it's frozen. Now, what that actually means is that you can't move it, but also we can't move it. And so when you see your physiotherapist, they will go through a series of tests, and one of the tests that they will do is to passively move your shoulder. Now, what that means is when the patient moves, we call that active movement, but when we try and move it as the physio, we call that passive movement. Now, the thing with frozen shoulder, and I'll give you an example with the lateral rotation, is the patient can't move it, but even with the patient relaxed and pain-free, the physio also can't move it, so it's restricted. Okay? Now, some conditions, the patient can't move it, but actually the physio can move it, and that will mean you probably don't have a frozen shoulder. The physio will normally go on and then just assess it in a few different positions, and again, it gets very restricted. With a frozen shoulder, you won't be able to get your arm all the way back. So it's really important at the beginning of, if you do think you've got a frozen shoulder, is to try and get the right diagnosis as soon as possible. And actually, you can try some of those simple tests, and if you've got any questions, then please do feel free to drop us an email or give us a call.